Hello, welcome to National News. I'm Rizwan Asad. I have with me Dr. Yusuff Shariff. He's an expert in functional medicine. Today, with the increase in obesity, diabetes, high blood pressure, youngsters are in a dilemma what to do. So I have got doctor who is a specialist in medicine, where he's going to explain how to control diabetes, high blood pressure. Welcome to National News, Doctor Sir.
Hello.
With the increase in obesity in youngsters today, people are in a dilemma because there are so many diets are there, so many medicines are there, and you have been in this field from past 25 years. So what is your advice, and how do you control medicine, high BP, and today all are going to the gym, how do you?
Actually, these diseases are called as lifestyle disorders. So, actually, lifestyle disorders means it is related to directly to the lifestyle. So, it is our food, our way of life, how we live our life. The whole system and the whole disorders starts from there. So nowadays we are into very hectic life, busy life, and we want everything like in seconds. So health doesn't comes in seconds. We have to work hard for the how we are working hard for our livelihood. We have to work hard to our health also.
To maintain our body.
Yeah. So we have to maintain our health through our lifestyle. Then only we can reverse it and we can maintain it. That's why there are peak. Every second person is a diabetic right now. Every second person is a hypertensive.
Even
Obese.
small children are
Yeah. They are prone to
diabetic.
Yeah.
Is it because of the food, junk food, or is it because of the lifestyle?
Actually, long back there were only two diabetes. One was type 2 diabetes and type 1 diabetes. Type 1 was acquired by through birth. So some viral infection was there, pancreas was being damaged, and then it was shifting to the type 1 diabetes. But now what we are seeing is type 2 diabetes is at the peak, and that type 2 diabetes is turning into the type 1 diabetes, type 1 and type 1.5, like that. It depends totally on the toxic load which is born in our body through our food, through our environment, through our air, through our water. So everything has to be considered, and we have to eliminate slowly one by one, because the detoxification capacity of our body is coming down. So we have to increase our detox capacity, so that whatever the toxins which we are taking inside through skin, through air, through water, through food, that has to be eliminated on day to day basis, or else these toxins will lead to hypertension, kidney disease, heart, diabetes, everything.
So you think that junk food today, you got instant pizzas, you got the instant burgers, instant chicken. We don't know how they are fried, how they are made. You think it's one of the main reasons that young children and even young are getting diabetes, and they're becoming obese.
In particularly young children's, they are very fond of
Junk food.
and also the cool drinks and all.
Okay.
So the sugar content, the amount of sugar content in it, we can't explain. Though that is being damaging the pancreas beta cells.
So how do you control this, doctor? And what is the remedy, and what is the medicine for
See,
the?
first of all, our concept is whatever we eat, we are our health. So if we eat a wrong food, then we are in the wrong pathway. If we eat a good food, we are in the right pathway. The problem with us is we don't know which is the good food and which is the bad food, because a lot of industries are coming up and claiming that this is a good food, and all. So the simple thing what we have to follow is what our ancestors followed before, and what our parents followed before, and they were healthy. So we have to follow the same routine. We should not go into the healthy and all everything. So we have to follow their footsteps.
Home cooked food.
Yeah.
With less of spicy.
Yeah.
And there is a saying also that you don't have food on time. That will get that vacuum and gastric problem will come, and you're putting on weight, and when you're eating, you don't know how much to eat. Like I was a good heavy eater, but now I lost weight, and then again I've come back. I've stopped exercising. So I think exercise also plays a very important role in maintaining health, because you're seeing nowadays so many youngsters are dying of heart attack and high BP, and in the gym they are collapsing. So do you think that the lifestyle is not maintained, they're not eating on time and they're eating junk food?
Yeah, and we'll speak about the gastritis, because that is a basic thing the disease starts from. So how, you told if we don't eat at in the proper time, it's okay. Only if we get the hunger, then we can eat, or else we can skip the meals. That is not a problem. Nowadays, what is happening is, because of our lifestyle, the medicine, we can say the medicine abuse. Abuse means, a person, what we have seen in the last, in my patients, every patient is addicted to a gastritic tablet, so he has to have,
Rantac,
the PPIs, proton pump
gels,
inhibitor. Yeah. That that is a very bad habit what we, we are addicted to.
your doctors prescribe that.
See, we prescribe for temporary, for 10 days, 5 days, whenever you are getting the antibiotics period. At that time we are prescribing. But the problem is, because the patient becomes self doctor and they take the self medicine.
Self medication is
Yeah. They take for a lifelong. Say, if the simple, because we are living in the Google era. If it's simple, we'll Google also PPI. What are the side effects? It will cause heart attack. It will cause hypertension. If you have kidney is very good condition, it will damage your kidney. So these are the side effects of the PPIs, gastritic tablets. But the person is addicted so much that he tells that without this tablet I can't live. Because if you take PPIs, what happens? The basic thing is the stomach. What is the function of the stomach? It has to absorb the food, whatever we take, we intake. So this PPIs will block that particular, the nutrition what has to be absorbed, that is blocked by the PPIs, because you automatically the HCl will go down. Suppose, for example, a person, I'm telling an example, HCl should be 100 grams for a particular person, a individual person, and I'm not telling exactly, I'm telling one rough figure. Yeah, 100 grams. If you check for every person, for every individual, 101% that nobody has 100% HCl, because of his lifestyle, if his stress, because of his food habits, because of his drug abuse, medicine, which he is not taking properly. I told gastritic tablet should be take.
Just a small.
Yeah. Whenever it is an emergency, we can take.
And,
but the problem is they will take for a lifelong. Yeah, this will inhibit, will stop the secretion of the HCl. The problem starts from there. The nutrition is not absorbed here. Because of the nutrition is not absorbed here, automatically you are landing into the diabetes, hypertension, obesity, thyroid.
Kidney, it will affect your
Yeah,
kidney
yeah,
also. So just one more question was, today, like you just said, self-medication is bad. You're going to a chemist shop and you say, I've got this problem, and the chemist is giving you the medicine.
Actually,
So what have you to say?
this is the fate of India.
The chemist is trying to pay the law for doctor.
Actually, he is not supposed to. But the problem here in India, because the patient doesn't want to go to a doctor and give the consultation fees, he wants to save that consultation fees, and he is risking his life on his own. Yeah, but it is in, we can say it is in ignorance.
And you were telling about some reverse diabetes. What is that? What exactly is reverse diabetes? Because I see so many ads, everywhere. You got diabetes. Reverse diabetes will help you. You have been an expert. You have been treating so many patients. What is reverse diabetes and how useful it is?
Reversing diabetes means that, suppose a person comes, he has a diabetes, started from 1 year, 6 months, whatever it is. So we assess why the diabetes has come. We assess the cause. Then we will try to reverse it, and we will try to rectify that. If we try to rectify, automatically the diabetes will be reversed.
How it will be reversed? With medication or with?
No, whatever we are giving, because we are seeing, we are detecting the cause. We are detecting the cause. For example, if it is because of the insulin resistance, we correct the insulin resistance through the supplements. This what we are giving.
You take out the
No.
the blood.
No. This is oral medicine. This is oral medicine. These are the supplements which has to be taken, which is bound to be produced by the stomach. Since it is not producing in the stomach, we have to take from the outside. That's why insulin resistance occurs. The insulin resistance means the insulin is produced in the body, but it is not working.
So like supposing somebody at the border of getting diabetes, say is today that his reading is 95 to 100, 110, and somebody is 400, 450. I've seen many patients who are 450. They're having their regular. They have their insulin, but they're having the sweets. They're having everything, and the person who's at 1995 is also very cautious. How do you maintain this? With say that the person is having 400, in spite of taking insulin and in spite of having his tablets, his blood sugar is not come down. And doctors, you go, they say you have to be 110, 110. You think, how can somebody be so perfect? What is the thing? Because there are a lot of complaints that doctors are saying this to help the farmers company. I mean, I should not be talking that, but. Sugar level varies from a patient.
There is something called as physiology. Physiology means normal function of the body. Why does if we are diseased, if we have a diabetes, that means we are into pathological state. We are not into the physiological. We are getting into the pathological state. So you are speaking about the insulin and the parameters and all. Recently, we had a couple doctors. Both the couples were doctors from Mysore. Actually, they had came to me. They got an heart attack, so they wanted to get treated for the heart attack. They came to me, and since they saw that I reversed diabetes, so they discussed the diabetes also, and we assessed there. So I came to know that the insulin was good. The production of insulin was good in his body. We have done the test, and he was taking the insulin from past 6 years. I told that doctor, we can remove this insulin, but he was a little bit reluctant, because he told in Mysore the best diabetologist has given this prescription and he is taking from past 6 years. Then his wife told, okay, since doctor is telling me, and I explained everything, how the mechanism works and all. So they were satisfied, and they told, yes doctor, you can remove it. Alhamdulillah, we removed in only 10 days insulin.
It's through Unani medicine or allopathic medicine?
This is known as functional medicine, and you can say in other words, you can say it is an advanced Unani medicine also.
Unani medicine.
Yeah.
But Unani medicine takes long time to cure, and allopathic is.
See, this is a perception what we have got it. It is nothing like that. What we are doing. Insulin is not working in your body. We are sensitizing the insulin. That doesn't mean that it will work for a long. There are certain medicine. There are a lot of medicine like that which sensitizes and even the simple medicine chakla.
So the one more misconception is there that having jaggery.
Okay.
You won't get it's a substitute for sugar. Jaggery doesn't contain that sugar content, and so people can have jaggery. I want to ask that question. And even there is a saying that to reduce weight, warm water you put lime and you put a lemon and do. But is honey and jaggery harmful for diabetic patients?
See, if it is in purest form, it is good for diabetes, not a problem. It is not good. I can't say it is good for diabetes. It is a healthy diet. I can say that like that.
Diabetic patient can have jaggery and honey.
See, it depends, because nowadays nobody is healthy. We have seen a lot of fungal infections in everybody, almost. Even fungal infection leads to diabetes. In that case, it is very harmful, both jaggery and honey and all. If they don't have any fungal infection, then they can have. And it is very difficult to find fungal infection, because recently we had one case. She was 65 years old lady, and she has a burning and itching around the anal canal, around the anus. She has gone to every corner of the doctor, and they were prescribed anti-histamine and all for cetirizine and all. And whenever she used to take the temporary relief for there, but nobody has thought that it was related to the stomach. Because of the low HCl, you will get the anal itching. And we corrected the HCl here, and the anal itching gone. And she was shocked to that. We can't even think about it.
Sir, one of my friend recently, he was unaware that he had sugar, and unfortunately, he lost on the toe. He lost his 2 fingers.
Mm-hmm.
So, what are the symptoms? For a patient, because nobody's got the time to go and do their sugar test, I think, unless something is dangerous. So, what are the starting symptoms of a person coming to know he's diabetic?
See, before 2020 scenario was totally different. So we used to predict every 10% standing, one or two or three person was diabetic. But now every second person is diabetes. Totally different. The scenario has been changed because of the food, lifestyles, and all.
Sedentary lifestyle.
Yeah.
No exercise.
No exercise. If you do exercise also, the problem is because of the cardiac arrest, and many patients are reluctant for going for heavy exercise and all.
So there's a misconception that diabetes is only for the rich people. Before. तुम पैसे वाले हो तुमको diabetes आता है. Now it's become very common. Even the poorest of the poor and the smallest of the small children is going. So any major plans are there? Any tablet is there which can cure, or just once a diabetic comes, lifelong has to stay with it.
See, one thing before, what I used to tell, just live your life whatever you are. Eat healthy food, drink healthy water, no cool drinks and all. But now the scene is totally different. But now what we consider is every person is not a healthy person until he is proved. Until because every person is an ill, because there is a wellness and illness. In between is the health. Every person is healthy, but nobody is towards wellness. So this is the basic concept we have to think and we have to go towards wellness, and we have to pay for it.
So what is your message to how to control diabetes and how to take precautions?
See, basic thing is the stress. We have to manage stress, because every single child, adult, whoever it may be, so they are under tremendous stress
and depression.
Yeah. Because a child is stressed because he is not getting the phone to play,
or his exams.
Whatever, because every person is stressed. So this has to be kept at bay. Stress, because stress plays a major role in diabetes, hypertension, obesity, almost every disease. So
if you're in depression, you tend to eat more food.
Yeah, because
and you don't know
because the ghrelin and leptin, these are the two hunger hormones. One is hunger hormone, one is satiety hormone.
And if you're in too much stress, you try to drink too much of tea, coffee,
because of stress,
because of you lose your hair and getting hair.
Because of stress, what happens? The leptin block will occur. Leptin is a hunger hormone.
One of the reason I don't get depressed or stressed is I'm always happy. Okay. So last message, Doctor Sir.
See, we have to maintain our lifestyle. We have to sleep a good sleep. It doesn't have any particular time for that, because a lot of studies are there. Better to go early bed at 10 p.m. That is the best thing. And avoid stress and avoid unnecessary medicine, because nowadays medicine has become like a chocolates. Yeah, that has to be avoided.
Thank you, doctor, for speaking with Nashiman News on diabetes. Before, diabetes was known as a rich man's disease, and now it's very common. And please don't take stress and don't be depressed. Lead a healthy life. Be happy. One of the main reasons, don't go for unnecessary medicines. Don't go over the counter and buy medicines. Consult your doctor. And if you have any symptoms, like, go and consult a doctor, because life is more important. Health is wealth. Early to bed, early to rise makes a man healthy and wise. The saying is there. This is Rizwan Asad signing off for Nashiman News.